Okay, listen, you got to give me credit for determination. All right, third time's a charm. If this doesn't happen, then it's a sign from the universe that I am not supposed to be live right now doing this video. Betsy with Birth in the Know, and apparently between yesterday and today, they've changed something where my tablet has to be straight up and not sideways. I don't know. All right, I'm trying to give my little spew of the day here. And don't you just love technology? All right, so I'm sitting and I'm holding my tablet right now instead of having it on my tripod thing. All right, take 3. This time, if it doesn't work, oh well, I guess tomorrow. So it's Betsy with Birth in the Know. And my question is, do you need a vaginal exam? Do you need any vaginal exams during pregnancy and labor? No, you don't. What are they doing when they do that? Well, they're checking your cervix. But the less poking in your vagina, the better. There is bacteria in there that's necessary, and we want to keep that stable and balanced. So the answer is you do not need to have a vaginal exam. You can actually say, no, I do not want this. There are so many other ways to know. You hear that? That's gunshot in my neighborhood. There's like a range somewhere in my neighborhood where they're shooting off guns. Sorry for that. This is just not the day. But anyhow, all right, back to the question. Do you need to have a vaginal exam in birth? Do you need any vaginal exams? Do you need to be checked? Do you need fingers poking at you during your pregnancy, in birth? No, you do not. Usually the last month, 4 to 6 weeks, you'll be checked, or you'll be checked. You won't even usually be asked probably if you want to be checked, so that your clinical provider can see what's happening with your cervix. But there are so many other ways to determine what's happening, what you're experiencing in your body, and sensations, and you don't have to have a vaginal check to know what's going on. Now, you can if you want to. I know what happens sometimes when a clinician does a vaginal check, the obstetrician or the midwife. They may go ahead and strip your membranes, like remove the amniotic sac and where it's attached. And that could cause stuff to start happening. And that could be without your knowledge. Now, I'm not saying everybody does this, but it can happen. Point is, having a vaginal exam is your choice. Do you want to be checked? And this is particularly disturbing during labor, because you already are focused and driven to be birthing your baby and be in the moment and allowing things to happen. And when you get disrupted and somebody comes in and says, hey, it's time to stick my fingers in your vagina. Sorry about the gunshot. Boy, that's disturbing, isn't it? All right, well, question is, do you need to have your vagina checked? The answer is no, you do not. You can say no. And I'm encouraging you to challenge every belief that you know about birth, or everything you think you know, and then choose. It's all up to you. That informed consent, informed refusal that I spoke into on Saturday is your key. That's your ticket. Check it out. This is Betsy with Birth in the Know. And sorry for the technical challenges today. It was about to be a no for today, but I promised myself that I would do 14 days of Facebook Live with a question of the day, and I did not want to break that promise to myself. So take 3. This is my video for today, my question of the day. Go ahead and explore your options. Go ahead and research that question to your heart's content and challenge what I have to say. Go for it. That's what I want. My goal is education for women to want to know more about birth, and hopefully well before they're in the midst, so you as a woman can take charge, take a stand, be the chooser of everything during your pregnancy and your birth and afterwards, and stand in your power and your confidence. Trust yourself. I'm sharing information. I'm asking in the form of a question because that's what I like to do. I want to put you into the question. Challenge everything. Birth in this country, in the U.S., is in crisis. 1 in 3 women are giving birth by cesarean section. Thank God we have that to save lives. And 1 in 3 women is way too many. If you're a woman and you're watching and you've given birth, share this. If you haven't given birth, go explore. Become knowledgeable. Knowledge is power. Thanks for watching today. Betsy with Birth in the Know, another one of my questions about birth so that you challenge all the interventions that are presented to you when you're ready. I'll talk to you tomorrow. I'll be back for another episode, and hopefully without any technical challenges. That would be awesome. Have a beautiful day. I'm enjoying fall in Florida. I have a long sleeve shirt. It's breezy. It was in the 60s this morning. Yes. Enjoy. Bye.